Hi, I'm Dr. Sean Jochim. I'm a board-certified sleep specialist at the Neurological Wellness Clinic. I'm here today to talk about obstructive sleep apnea. Obstructive sleep apnea is a very common condition that affects 18 million Americans. Obstructive sleep apnea is a life-threatening condition that is characterized by episodes of partial or complete blockage of the back of the throat while a person is sleeping. When they're awake, their breathing is totally normal, but when they fall asleep, these muscles relax, they collapse, and the airway shuts off and the patient can't breathe. Fortunately, the brain reacts to this and causes a partial arousal or awakening from the deeper sleep. But unfortunately, that leads to poor sleep, and the patients wake up feeling unrefreshed, and then throughout the day, they're very tired. Surprisingly, despite this poor night's sleep, not everyone who has obstructive sleep apnea complains that they're tired. Some people just learn to adapt to this insufficient sleep, and they go on with their day. So how do you determine if you have sleep apnea? Well, there's a lot of signs and symptoms that suggest sleep apnea. One and foremost is people snore. It may not be extremely loud, but everyone with obstructive sleep apnea actually snores. Just because you snore, though, doesn't mean you have obstructive sleep apnea. In addition to snoring, people will have the tiredness. They'll wake up feeling unrefreshed. They may have morning headaches, dry mouth, or sore throat. This fragmented sleep, interrupting sleep, can lead to mood disorders such as depression, anxiety disorders, just generally poor concentration. Children actually who have obstructive sleep apnea have a much higher incidence of suffering from attention deficit disorder. Why do we take obstructive sleep apnea so seriously? Well, in addition to causing people to be tired, it's also a major medical health issue for people. It really puts a lot of strain on the heart. When you're not breathing, there's a lot of pressure building up in the chest cavity, and the heart reacts to that. Not only that, but the oxygen levels when you're not breathing, you may not breathe for 30, 40, 60 seconds, and then the oxygen levels really drop as a result of that. When the oxygen levels drop, there's a higher risk of going into heart arrhythmias. Cardiologists commonly refer us patients who they initially diagnose with cardiac arrhythmias to be evaluated for sleep apnea because they're well aware that patients with sleep apnea have a much higher risk of having cardiac arrhythmias. There's also associated risk of having a heart attack, heart failure. It's associated with diabetes. People with untreated or hard to control high blood pressure may suffer from obstructive sleep apnea. There's a very high correlation with poorly controlled hypertension and obstructive sleep apnea.